Welcome to ANA community. What do you mean by Pitta Kshaya Lakshana? What are the Lakshana or signs symptoms are being observed when there is the decreased concentration of the Pitta bioenergy or Pitta Dosha in the body? That are the informations will be dealt in this particular video. Dear community members, press the thumbs up button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget the pressing the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you think about the Pitta Kshaya Lakshana, this is comprising of three different terms: Pitta, Kshaya and Lakshana. The term Pitta refers to the Pitta bioenergy, which is having the Tejo Mahabhuta dominance or Agni Mahabhuta dominance in the body, whereas Kshaya refers to the decreased concentration. So the Lakshana refers to the clinical features, signs and symptoms which are indicative of the decreased concentration of Pitta bioenergy in the body. So that is the overall understanding of Pitta Kshaya Lakshana. That is the topic of discussion today. When you think about the Pitta Kshaya Lakshana as such, so that is considered to be the in terms as far as the conceptual understanding is concerned. So that is Vate Pitte Kafe Chaiva Kshine Lakshana Muchate Karmanah Prakrutadhanihi Vritthirvapi Virodhina. So that means whenever there is decreased concentration or the decreased quantity of the any kind of the dosha in the body, so that is responsible for the decreased lakshana related to that particular dosha. So that means the functions of that particular dosha that will be getting decreased in the body, but the functions which are considered to be the opposite to that particular dosha that will be getting increased in the body. So that is the overall understanding of that. So when you think about the Kshaya, so that will be specifically we are talking about Dosha Kshaya. So there will be observed the decrease of any one quality or two more or all the qualities related to that particular dosha that will be getting decreased in the body, which in turn we are going to observe the decreased function related to that particular dosha that will be observed. As far as Pitta dosha is concerned, it is being mentioned Pitte Mando Anala Shitam Prabhahanihi Ashtanga Hridaya Sutrasthana 11th chapter. Whereas the Sushruta says Pitta Kshaye Mandoshmagnita Nishprabhataja. So when you think about the word meaning, Pitte Mando Analaha. Mando Analaha refers to the reduced appetite that can be seen. Shitam refers to the feeling of coldness in the body. Whereas the Prabhahani, the person will be having, or what we can say Nishprabhata, that is lack of luster that will be observed there. Mandoshma, that is nothing but the reduced temperature, or that is objectively observable raised body temperature, or otherwise what we can say raised heat that can be observed either locally or generally we can see. Whereas Mandoshma Agnita, that is nothing but the Mando Analaha. As far as the description told in Ashtanga Sangraha Sutrasthana, so that says Shaitya Aniyatatoda Arochaka Avipaka Angaparushya Kampa Gaurava Nakhanayana Shauklyadibihi Pittam. So that is related to the Ashtanga Sangraha, that is really giving the description of Pitta Kshaya. That is Shaitya, as discussed earlier, feeling of coldness that may be observed. Aniyatatoda, so that is pricking type of pain may be observed frequently, maybe in terms of the place or in terms of the timing. Arochaka, that is nothing but the tastelessness that will be there. Avipaka, that is impaired digestion. Angaparusha, that is roughness of the body parts. Kampa, that is involuntary movements. Gaurava, that is heaviness of the body parts. Nakha Nayana Shauklya, that is Nakha Shaukliya, or otherwise what we can say Nakha Shuklata and Nayana Shuklata. So that is whitish discoloration of the Nakha, that is nails, and Nayana, that is eyes, that will be observed as far as the Pitta Kshaya is concerned as per Ashtanga Sangraha. Now coming to the description of each of these in a little bit different manner, different approach, different perspective. When you think about the Manda Anala, so that means there will be poor appetite that may be seen, wherein the person will be having the aversion to take the food. This can be due to the increase of the Snigdha Guna in the body, or increase of the Guru Guna in the body, or increase of the Manda Guna in the body, or increase of the Shita Guna in the body, or increase of the Sthira Guna in the body, etc. So that can be observed, which actually is responsible for the Gurutva in the body. So this may happen mainly because of the intake of, in terms of the rasa is concerned, Madhura, sometimes the Tikta or Kashaya rasa as such, which is considered to be in terms of the Shita Viryata, we may suspect there. Whereas Madhura, Amla and Lavana, wherein we may suspect the increase of the Kapha dosha, wherein we may suspect there may be a possibility of a Pitta Kshaya may be observed there. And increased consumption of Shita Virya substances, naturally, which is having the opposite quality related to Ushna Virya, wherein there will be the possibility of the decreased functioning of Pitta dosha that may take place. And Vihara, like Divaswapna, so that is sleeping during daytime or having a nap after the lunch, as such, or otherwise avyayama, without doing any kind of the physical activities. These are the possible nidana that may be observed when there is the manda anala that can be seen in the patient, which is an indication of pitta kshaya. Shitatva, so that is excessive feeling of coldness, which is specifically that may be seen in terms of the decreased ushna as well as tikshna guna in the body that may be seen there. Hampered metabolic activities, that may be the outcome because of this, wherein the person may have excessive feeling of coldness. Prabhahanihi. So here see the skin, that is the some kind of the luster, one kind of the glow related to skin that will be lost. Here this may be observed because of the decreased Bhrajaka Pitta in the body. Bhrajaka Pitta, the location of Bhrajaka Pitta is Twak or skin. In that way, Pitta Kshaya we can able to understand. Mandoshma, that is reduced body temperature, which is observed objectively. Here this may be observed due to the decrease of Ushna or Tikshna Guna in the body. Aniyatatoda, Aniyate Deshe Kale Va, Todo Aniyatatodah. So that means inconsistent pricking type of pain in terms of the place or in terms of the time. So that is observed. So this can be attributable to poor metabolic activity in the body. So in this way the person may have aniyatatoda. Arochaka, so that is tastelessness. That is consequence of decreased appetite. Avipaka, because of the decreased appetite, the person will be having impaired digestion. So probably this may happen due to the adhyashana, vishamashana, viruddhashana, samashana, atyashana, etc. etc. Angaparushya, roughness of the skin, probably attributable to the Bhrajaka Pitta dysfunction. Kampa, so involuntary movements of the one or multiple body parts. So here, see this particular image showing the this particular image shows the abnormal dysfunction. This is specifically seen in case of hepatobiliary dysfunction. As far as Gaurava, so that is feeling of heaviness. This can be attributable to impaired digestion, wherein the macromolecules which are present in the alimentary canal, they remain as macromolecules. They are not going to get converted into micromolecules. In that way, Pitta Kshaya may be suspected. Nakashaukliya, that is whitish discoloration of the nails, and whitish discoloration of the eyes. So these are the lakshana that can be seen in case of a Pitta Kshaya. To sum up, the abnormal decrease in the Pitta Dosha that can be identified by abnormal decreased functions. This can be attributable to the decrease of either one or more guna of Pitta Dosha. Where there is exposure to Pitta Dosha, so that is alleviating etiological factors, that is the Pitta Kshaya Karana, we are going to suspect or observe Pitta Kshaya Lakshana in the body. Pitte mando vanalashitam prabhahanihi. So these are the Lakshana that can be observed in case of the Pitta Kshaya Lakshana. Dear community members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget, press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That's all for today. Something more in the next video. Thank you.